So we are giving a papillary incision along the papilla. This usually this releasing incision might not be required because you can take the papillary incision till the extended lateral incisor. So then you can actually undermine it. But here in this case I want to keep the flap shorter. So going to nicely you are releasing. Pinpoint area, because that might be a tract which is, once the palatal swelling has formed, then slowly it has perforated the labial side and then it has formed the small labial tract. Till we find the proper entire lesion, we need to slowly wipe off the we need a small excavator, then we will be able to cheese out the entire thing nicely. Here it comes. So nicely we will be curating the margin. So slowly we are trying to undermine the area. Here also we might have to undermine this part of the bone so that it can come out easily.